Welcome everyone. As we're waiting for all of our colleagues to join us for this webinar, I have put up a Mentimeter question for you to answer. If you can, please go to menti.com on your cell phone or computer or tablet and use the code that's at the top of the screen, 7226141, and submit your answers to this question while we're waiting for everybody to join us. Welcome if you're interested in participating. While we're waiting for everyone to get onto the webinar, feel free to go to menti.com and use the code 7226141, as you see on your screen, to answer this question. What activities can you do post-crisis to prepare your supply chain for the next crisis? I'd love to see other people's answers to this question. I see one person has already submitted some answers. So feel free to answer. And if you leave the same answer, if you would do the same thing, the same answer, feel free to submit that again. We'll see how our word cloud develops. So if you, I see Mohammed, thanks for putting an answer in. If you would like to put that in the Menti, go ahead and add it by going to menti.com. Thanks. And Nancy is saying all those answers are true for her. Welcome, Nancy. Glad you could join us today. We had more than 500 people register for this webinar, so 56 of you have joined so far, and so we're going to give a few minutes to let people log on and get into the Zoom. Thank you all. It's great. It's very fun to watch this word cloud start populating here, and we're going to talk about a lot of these ideas in the webinar. If you're just joining us, we have a Mentimeter question up here for you to answer while we are waiting for our colleagues to join the Zoom. If you would like to answer this question, go to menti.com and use the code 7226141 and submit your answer. All that information, the login and the code, are at the top of the screen. Nice. Preposition. Nice. As we're getting started and waiting for our colleagues to come on to the Zoom, we have a question on Mentimeter to ask. And if anybody would like to contribute their answer, that would be great. You go to menti.com and use the code at the top, 7226141, and answer the question: what activities can you do post-crisis to prepare your supply chain for the next crisis? I'd love to hear more of your answers. And if you agree with the same thing that's been written, you can write it again and it'll have a more prominent role in our word cloud. I have some questions. So we're going to give a few more minutes for people to join us. As I said before, we have over 500 people registered for this webinar. Right now, we're about up to 96 people joining us. To get us started, we have a Mentimeter question up here. What activities can you do post-crisis to prepare your supply chain for the next crisis? If you'd like to answer that question, go to menti.com and use the code 7226141. And I'm seeing some really wonderful answers here, many of this which we will talk about in the webinar. I'm glad you all have been thinking about this in preparation for this webinar today. Wonderful, wonderful. If you're just joining us, feel free to answer the Mentimeter question. What activities can you do post-crisis to prepare your supply chain for the next crisis? Go to menti.com and use the code 7226141. I will leave this Mentimeter going while we're doing the webinar. So if we can come back at the end of the webinar and take a peek at it and see what other things have been added and what has gotten to have a lot more emphasis, which we will see by the size of the word. So far, long-term agreements, trained staff, preposition have all taken a prominent role in this. I'm gonna look at the chat and see what, okay. Someone has asked if it's okay if you record this presentation. You may. We are going to be recording it ourselves and sending it out to everyone afterwards. So no need for you to do it as well. But if you'd like to record it, you may go ahead and record it. All right. I think so that we have enough time for questions and answers at the end of the webinar, I think we're going to get started. So the Mentimeter is still going, but I'm going to change the view and get into the presentation so that we can get on with the webinar, and then we can go back to the Mentimeter at the end if we wish to see what everybody has added. So I'm going to turn it over to Greg now.
Okay, thanks, Barbara. Hello, everyone. Welcome to today's webinar on preparing the supply chain for the next emergency. My name is Kush, and I'm joined by my colleague, Barbara Lamphere, to present the webinar. Barbara, can you take a minute to introduce yourself?
Sure. I'm Barbara Lamphere, a Senior Technical Advisor at JSI. I've been working in supply chain for the past 30 more years or more in developing the capacity of individuals and organizations to manage their health commodities. I've been working in humanitarian supply chain response, particularly in capacity building for the last year and a half or 2 years.
Okay, thanks. And I'm Greg Roche. I've been working in supply chain for a little over 20 years, and I focus on supply chain assessments, system designs, and other related activities. And I've also been working in humanitarian supply chain for about the last year or so. We're happy to have you back with us, or welcome you if this is the first time you're attending a webinar presented by the Building Capacity to Improve Commodity Management in Humanitarian and Disaster Settings program. As we get started, please feel free to introduce yourselves using the chat function in Zoom. As Barbara mentioned, we will take questions at the end of the presentation. If you have a question, please use the Q&A button found at the bottom of your screen to submit your question, and please don't use the chat button for that part. We'll start now with the quick introduction to and overview of the project and the contents of the webinar.
First, we want to give you a brief introduction to the USAID Bureau of Humanitarian Assistance, formerly known as the Office of Foreign Disaster Assistance, OFDA, capacity building program through which this webinar is made possible. The overall aim of the program is shown above. And here are the main objectives of the program. As you can see, the program is really about building capacity of implementing partners, both at headquarters and field level, to better manage their health commodity supply chains in a humanitarian setting. In terms of accomplishments in the recent past, we've conducted 2 training workshops for implementing partner headquarters staff on managing health commodities during a humanitarian response. These have led to a request to provide similar training for implementing partner in-country staff. We developed an addendum to the Supply Chain Manager's Handbook on managing health commodities during humanitarian response, which we will share in a follow-up email to this webinar, and have also conducted a webinar to introduce that handbook addendum. Some of you probably attended that webinar. And obviously we're doing some webinars now to further build capacity in humanitarian response supply chain management. We have also interviewed implementing partner staff across the globe, collecting and documenting best practices in supply chain and humanitarian response settings. We will share some of those best practices in future training and in today's webinar. Program staff have also participated in various working groups and consultative meetings with the emergency response community, including logistics and health clusters. And we have also developed an inventory of logistics management information systems, highlighting how they can be useful in humanitarian settings. We can also share that resource in the follow-up email after the webinar.
Now, here are the objectives for this webinar. We will identify the 4 phases of humanitarian response and the main focus of each. We will describe a process that can be applied to learn and prepare for the next emergency. We will identify specific activities to be done at the end of the post-crisis phase that can help prime the supply chain for better preparedness. We will also identify specific areas to look at and questions to ask during the post-emergency assessment. And finally, we will identify who should be involved in the post-emergency assessment. Let's look at some of the supply chain practices and considerations for managing health commodities before, during, and after a humanitarian response to a crisis. Let's first review the general framework within which we can discuss supply chain management considerations for healthcare products in a humanitarian context. This is a conceptualization of the phases of humanitarian response efforts that draws from similar summarizations from VHA, UNFPA, and OECD. The cycle starts with preparedness prior to the crisis, then the acute response phase when the crisis presents itself and initial actions are taken, then a protracted phase over a longer term, and finally into the post-crisis phase when things are returning more to normal. Keep in mind that within the overall humanitarian response context, the supply chain context changes during these phases, informing the kinds of activities that the involved organizations undertake and therefore what the requirements of the supply chain are. We will now look briefly at typical activities that we can find during each of the 4 phases. During the preparedness phase, governments and partners can be planning and implementing activities prior to a possible humanitarian event to make their eventual responses faster, more resilient, and more aligned with the needs of the affected populations. At this phase, investments can be made in the supply chain structure, policies, procedures, capacities, pre-positioning of key supplies, responder training, and other operations that can support these activities and objectives by preparing the supply chain to be more agile and responsive. Generally speaking, for our context, The acute response phase is just after the crisis hits and when initial efforts are made to address the crisis. During this phase, the mortality rate has the potential to spike as the population is exposed to the disaster event, and response efforts focus on immediately averting this potential mortality. If local resources can address the needs, then they can do that. Otherwise, the host government can express its needs and the international community can mobilize. At this phase, the supply chain is focused on rapidly mobilizing life-saving commodities and supplies to the affected areas, possibly using kit forecasting tools to get a rapid grasp of quantities needed. At this phase, we would also generally prioritize speed over long-term efficiency and visibility.
In the protracted phase, the peak potential for mortality has passed, but the situation has not completely stabilized. The affected populations may not have returned to their original homes, and the prevailing health system may not yet be able to provide normal services. Responding organizations may begin to transition to providing routine health services to displaced populations and may begin building capacity in local institutions to return to normal service. Governments and partners can also work to support rebuilding of infrastructure damaged during the disaster. In this phase, supply chain operations for health commodities may shift to become more efficient by improving forecasting and developing more formalized supply planning operations from more sustainable sources of supply. In addition, the capacities of service delivery facilities, storage, distribution, and information systems may improve and become more consistent, while demand becomes more predictable. We also need to recognize that not every disaster will turn into a protracted emergency. In some cases, the community will recover from an acute emergency without an extended period in between. In the post-crisis phase, the situation has stabilized. The host government and its partners return to providing regular services and building long-term capacity. There may be an opportunity to build the system back better, or to redesign the system post-crisis to adjust better to permanent changes that took place resulting from the crisis. The supply chain returns to focusing on routine delivery operations, as well as risk management and preparation for any future crises. Therefore, the topic of our webinar today. The supply chain strategy should adjust accordingly to the progression of the humanitarian response context and the shift from less predictable demand to more predictable, and from less predictable supply, including lead time, to more predictable. When we return to routine operations, we would do the actions listed here. We would need to demobilize any resources that were deployed on the ground. For example, if we hired warehouse or transport services, then we need to ensure that those contracts are ended. If we borrowed trucks from a region, the trucks need to be returned to that region. We also want to be sure to update all of the data that we had or used during the emergency response, and especially any new data that were gathered during the emergency response, such as those related to costs, commodities, our stockpile, and our suppliers, as well as any materials and protocols. And we will also need to replenish any stockpiles so that products that were used and that are needed to be on hand are available for the next emergency. Also, we need to integrate any new products or supplies that were brought in related to the emergency that will remain in the supply chain. Now let's turn to the main topic of this webinar, learning from our experiences in responding to a crisis in order to help us prepare for future crises.
The way that we can learn from this experience to help prepare for future crises is to conduct a post-crisis review. The overall goal for the review is to examine our supply chain and everything that we did or that happened during the emergency with the goal of improving for next time. For this, we would want to look at both policy and operations for any revisions that are required. It might even happen that the ability to implement operational improvements will also require policy changes. For example, if the country experienced problems with the importation of some products, there might need to be policy changes related to the importation of emergency products in order to implement a related supply chain improvement. Here are some activities that we might want to do as a result of our post-crisis review to better prepare our supply chain for the next crisis. We will look at some of these in more detail in a moment. For example, for now, if in the past we had not undertaken risk management or developed readiness checklists and so forth, improving these areas should help us to respond to the next crisis more effectively. Here are some additional activities that we might want to do as a result of our post-crisis review. Let's do a quick poll to see what your experience has been in conducting post-crisis supply chain reviews. Please answer this question. Have you ever participated in a post-crisis supply chain review? You should answer yes or no. We'll take a few seconds for people to respond. We have about, wow, 181 people participating. So let's get some responses. We're up to about 100 responses. We'll wait a second to get more. A few more seconds. Okay, let's go ahead and close the poll. Thanks for those who are able to answer. If you didn't, that's fine. So it looks like we have about a quarter, about 26% of our participants have participated in a post-crisis supply chain review. That's a great proportion. And for those of you who have not, about 3/4 of you, let's hope that and expect that in the future you will participate in a post-crisis supply chain review. Let's take another few seconds to think. And now this question is for those of you who have participated in a post-crisis review. So the 25%, about 33 of you. Which of the following activities, aha, there we go. So now looking at these selections, these activities, for those of you who have participated in a post-crisis review, which of the following activities have you done post-crisis to better prepare your supply chain for the next crisis? And you can choose all that apply. It's not one only answer. Have you undertaken a risk management assessment? Have you developed readiness checklists? Have you engaged with international coordination mechanisms? Have you developed relationships with suppliers? Have you created country-specific importation requirements and documentation? Have you developed a list of vital products? Have you become familiar with existing health kit designs? Have you provided supply chain training to staff? Have you improved coordination with other implementing partners? And finally, have you gotten input from the community on gaps, successes, and opportunities for improvement? Take a few seconds. Again, please choose all that apply, any of these that you have done. It can be more than one answer. A few more seconds. Okay, so it looks like about half of you, oh wow, these are really impressive. It looks like about half of you have undertaken risk management and developed checklists. About a third have engaged with international coordination mechanisms. About half of you have developed relationships with suppliers. That's great. Some of you, about a third, have created importation requirements, documentation. Half of you developed a list of vital products. You've become familiar with existing health kit designs. The most answer is provide supply chain training to staff. We all know that capacity development is extremely important. At least half of you have improved coordination with other mechanisms and partners, and you've gotten some input from the community. So that is great. So thank you very much for sharing that information. And we will look at different aspects of these different activities as we go now through the webinar.
Great. So now we want to share a few specific examples of post-crisis supply chain improvements that have been made by implementing partners we have interviewed, many of which have become best practice examples. One area that offers much potential in preparation for future crises is building supplier relationships. In addition to the best practice of identifying and shortlisting qualified suppliers for products usually needed during a crisis, the practices listed here have proven beneficial. International Rescue Committee in Kenya and other places has made arrangements with suppliers to pre-position products, so those products would be available quickly to IRC in an emergency. So literally having products being held by those suppliers for the benefit of International Rescue Committee. Save the Children in Kenya, Alight, and Relief International have entered into framework agreements with suppliers to improve their humanitarian response efforts. These agreements may specify mutually agreed to lead times and prices, allow for flexibility in quantities of products procured in response to immediate needs, may guarantee shelf lives and length of expiry dates, and streamline the tendering processes, which all help to shorten the procurement process and allow it to adapt to the specific needs of a humanitarian response. Similarly, another strategy to prepare your supply chain for the next emergency is to coordinate supply chain responsibilities with other implementing partners. In many cases, it doesn't make sense for each implementing partner to separately procure, store, and distribute health supplies in response to a crisis. But to designate a partner which does procurement, another or the same partner which might be responsible for in-country logistics, and maybe another with other supply chain functions. An example, in Jordan, UNHCR recognized challenges around procurement with different implementing partners procuring individually, requiring their own staff, processes, schedules, and tools. Their capacity and expertise in procurement varied, which made procurement difficult and in some cases required support from UNHCR. UNHCR made the decision to streamline all health commodity procurement through one implementing partner, International Medical Corps, who does all health procurement for all partners. This decision required a reorganization of roles and responsibilities amongst implementing partners. UNHCR worked with implementing partners to develop and define a streamlined human resources approach for health facility staffing with clear roles and responsibilities. So this is a real organizational change. They needed to define the supervision pathways, meeting schedules, and communication platform norms. And then they identified one medical coordinator per partner to streamline responsibility and authority mechanisms in order to support a more organized procurement process.
In terms of how to manage the post-crisis review process, here are some basic steps to follow. You can assemble any tools, data, information that you had prior to the emergency or that you used last time to prepare your supply chain emergency response. Tools might include supply chain SOP manuals, standard operating procedures, including any that are specific to emergency response. You might also have Excel sheets or other electronic tools, such as Electronic Logistics Management Information System, either for the supply chain generally or specific to emergency response. Data might include inventory data on products particular to the crisis or regular inventory items that were used during the crisis. We mentioned earlier that as you return to routine operations, you would update all of your data sets to take into account data generated during the crisis. So you'd want that data as well to use during the review. You would develop a set of questions that you would want to ask to help you conduct the analysis. We'll see examples in just a moment. You should also call a meeting or meetings with relevant partners to conduct the review, do your analysis, identify problems, identify lessons learned, and any actions to take to better prepare for the next emergency. You would develop an action plan and put the plan into action. This is when you make your supply chain or other improvements. The action plan should also include making sure that things are put back to normal. So, for example, if stockpiles were used, do the stockpiles need to be replenished? Barbara mentioned this a moment ago. If vehicles were borrowed from one region to another, have they been returned? And were they repaired as needed prior to returning them? If staff were reassigned, are they being returned to their normal assignments? Finally, you implement the action plan and be sure to check in from time to time to assess progress of the implementation. Are there any other changes needed? And so forth. If we want to think about supply chain areas that we would look at during the review of our supply chain during the crisis, we should not be surprised to find that we would look at any and all supply chain functions areas that are involved during an emergency. More than likely, it will be all supply chain functional areas. I'm not sure there are any supply chain functions that would not be involved during the emergency.
Generally, these are the kinds of questions that we want to be asking during our review and assessment. What did we intend to happen? What actually did happen? What did we do well that we want to keep doing? And what didn't go so well that we would want to improve for the next time? As part of our post-crisis review, we want to discover how well the supply chain performed during the emergency. Performance can be measured based on common supply chain performance indicators. These indicators can help us pinpoint specific areas in need of improvement. Here are some of the indicators that we might use. We will link a reference for you to use for supply chain indicators in the follow-up email after this webinar. Of course, the challenge in measuring supply chain performance indicators is gathering the data for the indicators. Hopefully the supply chain has a logistics management information system which was collecting data during the emergency. You will want to use whatever data were available to gather during the humanitarian response to determine how well it performed against each of these indicators chosen.
Now let's think about some of the specific questions we might ask during our post-crisis review. If we think about the area of product selection, we would want to ask, did we select the correct products for purchase given the nature of the emergency? What additional information could we have used to better select the products needed? For quantification, how accurately did we forecast the quantities of products needed? Is there anything we can do now to be better prepared to do better forecasting in the future? Do we have large quantities of products left over? If so, how can we use them before they expire? Do our data sets need to be updated? In procurement, were we making international procurements when local procurements might have been an option? Or did we do local procurements when international might have been better? Were the procurement processes efficient? What can be done to make them more efficient? Were the products easily importable into the country? Do any importation processes need to be changed?
In the area of inventory strategy, here are some of the questions that we might want to ask during our post-crisis review. Did we transition from kits to individual products at the right time? Did we make appropriate use of push or pull systems? Were stock levels reasonable? Did we experience excessive waste or expiry? And were our procedures for waste disposal sufficient and effective? How can we better prepare for this in the future? In warehousing and distribution, some of the questions during that review would include, were warehousing and distribution capacity adequate? If not, what other options might we have, either in the public or private sector? Did normal operations in some areas suffer due to displacement of transportation resources? Did all relevant populations have equal access to the products used to address the emergency? In our system design and strategy, we might ask, do we need to develop additional system components to specifically respond to emergencies? Do we need to have something different than our normal supply chain to respond to emergencies? Which elements of our system can be further developed to maintain performance in the event of an emergency? In the area of information systems, how did the information system perform during the emergency? Was needed data gathered? Are we getting it to decision makers in a timely fashion? Can the LMIS be further adapted to better perform during an emergency? Or does the emergency system need improvement?
If we think about financing, these are some of the important questions we would want to ask. Was there adequate financing available to respond to the emergency? If not, what additional sources of funding might be mobilized prior to the next emergency? We need to think about two streams of funding: funding for procurement of important products, but as well funding for supply chain operations. We need both of those for our products to be available to address the emergency. Can funding or credit be mobilized now so that it is available immediately upon the onset of the next emergency? In the area of risk management, were we taking acceptable levels of risk in our emergency response? Were there risks that can be better mitigated prior to the next emergency? If we think about who should be involved in the post-crisis assessment and subsequent discussions, analyses, and implementation of any changes or improvements, it might be redundant to say all concerned parties should be involved. In fact, it will depend on how each country structures its emergency response teams. Are there staff that are designated or dedicated to emergency response? Or is it the everyday staff who take on additional responsibilities? Is there a standing committee in charge of planning for emergencies and monitoring the global situation to be alerted to emergencies? Whether it's a full-time dedicated staff or routine staff who assume emergency duties, there should probably be staff who can assume the kinds of roles that are listed here. If you don't have these roles designated in your country or in your program or in your organization, then one thing you could do to increase your level of preparedness for next time would be to designate these staff and define their specific roles and responsibilities in times of emergency. In addition to any emergency-specific staff, you also need to understand how the supply chain performed as a whole. So you would want to also involve program staff. First, for any programs that were primarily impacted or involved in the emergency response. For example, assuming a COVID-19 vaccine eventually becomes available, the immunization program will probably bear a large portion of the responsibility for getting those vaccines out to the people and getting the population vaccinated. So, post-crisis, the vaccine or immunization program would definitely be involved in the post-crisis assessment. But you would also want to involve staff from other programs as well to see how their program activities might have been affected. If resources were drawn away from some programs to respond to the emergency, then you need to determine how could that be avoided next time. Remember, we want to have our supply chain be resilient enough that it can respond to the emergency while still maintaining routine services. When we talk about supply chain staff, leadership, and program staff, a lot of these are most likely found at the central level. But remember that we also need to understand the overall situation, what was going on throughout the country and throughout the supply chain, and how it impacted all of the various supply chain actors. So we would want to involve downstream supply chain staff as well, regional staff, district staff, even down to the service delivery point. Remember that even in a time of crisis, the service delivery points still remain as a client within our supply chain. If your country or your program uses private sector service providers as part of your emergency response, you would also want to involve them as well in the post-crisis assessment. You would also involve any NGOs, any civil society organizations, or any faith-based organizations that were involved in the emergency response. Finally, you would invite any other actors that were involved or that might have been impacted by the emergency.
Once the review of the performance of the supply chain during a humanitarian response has been completed, we would then want to liaise with other functional areas such as surveillance and communications to ensure better coordination with supply chain during the next emergency. We would need to update them on proposed changes to the supply chain and then determine how that might impact coordination with other functional areas. The overall goal for this review is the same as that for a supply chain review, to examine what we did during the emergency to improve for next time. The difference here is that we are focusing on how the supply chain interacted with other non-supply chain functional areas. Let's quickly have a look at some resources that are available to continue to learn more about supply chain management for healthcare in humanitarian response settings. We want to remind you of a few resources on health supply chain management in humanitarian settings. These include the addendum to the Supply Chain Manager's Handbook and the handbook itself. We encourage you to download the 2020 version of the Supply Chain Manager's Handbook at the website shown. So you can download the full handbook, including the addendum, or if you already have the handbook, you can download the addendum as a standalone document. And we will share the links for this in the email we send you after the webinar. We will also provide the recording and the related resources from the webinar that we did in February 2020, during which we introduced the addendum handbook. Here's a list of other resources that you can find on the internet. This list is also provided in the Supply Chain Manager's Handbook Addendum, and this slide will also be included with this presentation that we will share with you after the webinar. And again, we want to mention the humanitarian response clusters as additional resources, and we will also provide you with these links to their websites for additional information. So
this is the end of the webinar. Today, we have identified the 4 phases of humanitarian response and the main focus or activities of each. We have described a process that can be applied to learn and prepare for the next emergency. We have identified specific activities to be done at the end of the post-crisis phase that can help prime the supply chain for better preparedness next time. We have identified specific areas to look at or questions to ask during the post-emergency assessment. And finally, we have identified who should be involved in the post-emergency assessment. We would like to remind you that you will be receiving the follow-up email with the additional information and links to resources that we have mentioned during the webinar. We have some extra time before our time is finished, so we can take some questions.
Okay, let's look at some questions that have come in. And I see that one question, we assumed the post-crisis will go with one way, however it went with another. So in some cases, what are your concrete recommendations to respond to the crisis? For example, in the case of COVID-19, we did a lot during the first wave and planned accordingly, but if it goes differently, I'm not quite sure what the question is here. So what if it doesn't go the way you think it's going to go? Greg, do you want to take a shot at that answer? And I'm going to check and see if also if Nadia has joined us.
Yeah, let me take a stab. I think I'm not sure we can give exactly the concrete recommendations, because the concrete recommendations will depend on what you find during your assessment. So in your question, you're saying we thought it was going to be like this, but in fact, it was different than that. The number of affected people, affected areas, and outcomes. So you need to look at what were your assumptions before the emergency compared to what actually happened during the emergency. And then you can say, for a future emergency, let's revise our assumptions and assume that things might be more similar to what actually did happen during this other emergency. And so then you can sort of think about, what do we need to do to prepare for that situation compared to what we prepared for last time. I know it's not very concrete, but I also think it's not, I don't think it's possible to say exactly what you should do, because now it depends on the comparison of what you thought was going to happen and what did happen.
Okay, so
And
I'm going
Greg,
to ask Nadia. Oh, good. Go ahead, Nadia.
just to compliment.
So let me introduce Nadia. Let me introduce first. Nadia Olson is the activity manager for the project that supports this webinar. So I'm going to ask for her to join us in the discussion. Nadia, go ahead.
Thank you very much. Thanks for the introduction. Apologies for jumping in so quickly. To build on what Greg said, it's really important in preparedness, supply chain preparedness, to take an all hazards approach and to consider that you are working to create over time a continuity of operations of your existing supply chain. So the ideal in preparedness is not to come in with a parallel supply chain that works, separately from your existing system. Of course, it's very hard to get to that point where you have that much redundancy and resilience in your existing system, but that's the goal, to take to develop a continuity of operations plan, to look at all of the elements of your supply chain, and for each of those elements, create a backup plan so that your existing supply chain can respond effectively to any hazard, rather than prepare for one hazard or another. So it's always not a good idea to say, oh, we're going to prepare for an outbreak or we're going to prepare for an earthquake. It's better to look at any hazard that your situation may face and then prepare from a general perspective for anything that could go wrong. There are tools out there on continuity of operations. There are tools out there on taking an all hazards approach. The Sendai framework is something you can look up for an all hazards approach in disaster preparedness. And then on continuity of operations for supply chain, we have started to develop a tool, and it's not published yet, but will be available in October. that will help start folks to understand how to set up continuity of operations for supply chains in fragile and humanitarian settings. Thank you very much.
And we will we'll be sure to make sure that everybody who attended this webinar today will get that document that's still in process. There was another question that is similar in nature. It's at what point in time do we commence integrating emergency response into our routine supply chain management response? For example, HIV/AIDS response is now integrated into routine healthcare response. And I think as Nadia was saying, it's better if every aspect of our routine supply chain is thought of as part of, as able to address the emergency, to be able to respond as needed during an emergency. So it's not necessarily a point in time, but it's a continuous process of evolving your supply chain to better handle any changes. And so when you do your risk management plan, you're looking at each action in the every aspect of the supply chain and saying, if this could happen, how would our supply chain respond, and what can we do to avoid disruption by improving certain aspects? So maybe you have you may have what if flow charts to say, or a contingency plan. If we lose electricity entirely, how do we maintain our cold chain, or how do we do this and that? And so that you need to plan for all those kinds of things as part of your routine supply chain. Greg or Nadia, do you have anything else you want to add? Okay.
Integrated, having a separate, but that you can respond in an emergency.
I'm sorry, it's breaking up, so I'm not hearing everything. I don't know if maybe I was breaking up, or so sorry for the connection if there's anything. There's a comment, and I'm not sure if let me look if there's a question in here. Thank you for the presentation. Any recommendations concerning fragile countries where supply depend on humanitarian or procuring from abroad, like in the case of COVID restrictions, have increased this challenge? So I think, if you're in a fragile country where most of your products are coming from abroad, what in our experience, I think just making sure you have good coordination mechanisms and communication mechanisms, you're keeping in touch, you're talking about your plans, you're using those forums to build supplier relationships, if that supplier is an international agency or a manufacturer, that you're building those relationships and talking about how you would handle any particular emergency. I think that's important. Anything else anybody wants to add? Okay, someone's asked about if there's any short courses to enhance supply chain management skills of staff in humanitarian settings. We will be running some courses. COVID has changed our plans for those. We stay tuned and we will let you know. We will send out some links for some courses on basic supply chain that could help you, but in terms of specific to humanitarian, we'll be working on those and we'll let you know. There's a question here. In the acute phase, it's been observed that there is a high fluctuation of consumption rates and it becomes difficult to quantify. Are there any tools to quantify during the fragile time? Nadia, do you want to say something? Are you still on with us? Do you want to say something about some
Sure.
of the tools?
Yeah, I'm happy to respond. I also responded in writing to a few questions.
Okay.
I included some links to some forecasting tools for kits. And then this also helps to answer another one of the questions, which was how soon should we start thinking about moving beyond the acute phase? I think as soon as you have data coming through your system, even if that data is service statistics, it is good to shift over your forecasting from the initial maybe demographic approach you may have taken when you didn't know what the population was looking like, what the disease burden was going to be, how many people were going to be affected. That data is a lot less accurate. But as soon as you can have some service statistics, it's good to compare those service statistics with the forecast that you did, or the kit forecasting that you did, and start to shift over. And if you can eventually even get to the point where you can be using your existing information system, perhaps even DHIS. Sometimes some countries have a logistics module they've added in. They can even collect some consumption data and start doing the forecasting on the basis of that. When you do that, you're starting to use the same tools that you use on the development side. So there are some forecasting kit tools that I've linked, but for the other exercises, generally we use the same principles that we use in development. You just have to do it more often and more frequently. There's the QuantumMed forecasting tool, but also most quantification experts simply use Excel and because it's a little more flexible. We have a tool that we developed with UNFPA to transition from kits to individual procurement of reproductive health supplies, and the RH forecasting kit tool that I linked in the answer also helps to do this because it lists out all the products. So you can also insert in that document, in that Excel, your consumption data and shift over. So if you want to follow up with us on any of these questions for forecasting, and hopefully we'll have a webinar on this down the line.
Yeah, and we will send out any tools that any links that Nadia has referenced to everyone, so that if you didn't see that answer, we'll be sure to get those to you. Another question has come in from Edson. Nice to see you, Edson. How can we strengthen LMIS during the recovery period? Greg, do you want to say something about that? Or Nadia, feel free.
Sorry.
It's okay.
For the LMIS, I think in the recovery period, I mean, often we find in a lot of these very fragile settings that there wasn't even an LMIS.
Right.
And then when we do have an LMIS, in a humanitarian setting, sometimes if it's an automated system or it's a system that needs to be very integrated or requires a lot of time, then it can break down. So in the recovery period, you could develop some backup plans for how you use your LMIS in the case of a loss of electricity, in the case of a need to accelerate the process. You can use some mobile tools to automate your LMIS, but in a way that's a little bit more resilient in the case of an emergency. You can find some ways to circumvent levels need to. So it's also in the process, not just in the tool or the system itself, but the process you use for using the tool. Another thing you can do is create a module in your LMIS that will be specific for emergencies. You wouldn't integrate all the products that you use in emergency into your broad LMIS until those products have been integrated into the system. But in that module, you could use that module. And again, I mentioned that some countries have created a logistics module within DHIS, and a lot of countries use DHIS too in humanitarian situations. So that's another option, is to not use your existing LMIS, the national LMIS, and instead shift to the module in DHIS2. Mm-hmm. Those are some ways.
Yeah,
but it's hard.
Right, it is hard. And actually, I know that in one case, and this was in my some interviews I did with Alight in Rwanda, one of the things that they did to improve their LMIS after post-crisis review was actually fairly simple, and that was because there were so many different players involved in the emergency response, but they collected data in so many different ways, but with to just standardize so that everybody would, so that they figured out what the best paper form was, what the best electronic data collection was, and to standardize across everybody that was involved in the response. So if you have a response where you have multiple players, maybe geographically distributed, that if everybody can uses the standardized form, and so then everybody can understand the data that's coming in. And I think that has certainly helped in the case of Rwanda for the refugee situation there and so forth. Let's see. Someone's asking about the webinar and whether there going to be more educational events. As we said, we'll try to produce some more webinars. I think it sounds like that there's a call for some forecasting and quantification, and that would be a good one to do. And so we'll keep that in mind. Are there any specific tools LMIS tools used in emergencies? And at least in my experience, and Nadia, please jump in. I think generally, that generally we try to encourage the same, not specific LMIS tools. I mean, not to think of the supply chain for emergencies as a different supply chain, but using the same tools, which if they have a strong foundation, if they're built on the principles of good supply chain management, then those are useful, and that during emergencies you may change frequency of reporting, but that the same tools, whether it's a report and requisition form or whatever form, are useful in all cases. You may have a different set of products for emergencies, but the general tool design is usually sufficient. Nadia, is there anything you want to add about that?
Yeah, the principles are the same. The essential data are the same. The forms can even be the same. It's more the process that you apply, the frequency that you collect, the levels that you circumvent, the number of actors you have to integrate, and streamlining that process as much as you possibly can. And in the preparedness phase, when you take that all hazards and continuity of operations, you create a plan for how you might circumvent that system or use a module or streamline the process in the case of an emergency. So it's better upfront to think, okay, we may not be using our standard LMIS and process. We may have to use this other module, or we may need to, integrate other products, and we may need to skip levels, and we might be using iPads and phones instead of computers and the same, and we may need to include many more actors. So it's thinking about all that, but the principles are the same and the systems are the same. Even the organizations that have created LMIS in emergencies are basically creating very similar systems to what's used in every other supply chain operation in the world, even on the commercial side.
So we're coming to the end of our time, and I want to thank everybody for joining us. Greg, do you want to finish up? And I know that there were questions we didn't get to, and we will try to do that in our follow-up emails. So Greg, do you want to go ahead and I'm just showing our Mentimeter word cloud as we finish up here.
Okay, thanks, Barbara. And as you said before, we really tried to touch on, and I think we were able to touch on a lot of the topics that you guys have identified in terms of preparing for your next crisis in your supply chain. So really, we want to thank everyone. We had about 160 participants. We are very humbled by this. We appreciate that you took the time to participate, and we hope that this has been useful for you. We know that you have busy schedules. We hope it's been interesting. We hope it's been beneficial again. And finally, we want to thank everyone for the very important work that you do in helping to respond to humanitarian crises around the world. And we wish you all the best of luck in your work and improving your supply chains to be able to respond to emergency contexts. We want to say thank you once again. Thanks, Barbara. Thanks, Nadia. Thanks everyone, and goodbye and good luck.